Hi guys, Sydney here in the AAFE Training Center. We have Elizabeth with us. So we have a very exciting Botox treatment we're going to do today. This patient has been seen a couple times over the last year. We finally kind of nailed her dosing, and we're going to go through kind of top to bottom, work up, and kind of co-treat her together. So starting with her frontalis, I'm going to have you raise your eyebrows and relax. And when we're looking at her forehead, we're noticing the shape of her forehead, kind of if she has any static creasing, the set of her eyes, things like that. I'm gonna have you raise again and relax. I'm gonna mark those lateral borders of her forehead and raise and relax. So we have movement kind of all in here, and we want to treat this muscle in its entirety. I'm then going to stay just above her brows so that we don't drop her brow. This frontalis muscle, if overdosed, can definitely drop those brows, and people do not like that appearance, understandably. I want good, thorough coverage of this muscle. Raise for me and relax. And with these dots, I feel that I'm achieving that. So, moving on to glabella. The glabellar complex is composed of two corrugators in the procerus. Make an angry face for me and relax. You can see when she makes that angry face, she probably has a little bit of neurotoxin still working in there just because she doesn't have that strong pull. Go ahead and make an angry face. Good. I'm still going to treat her because she does have some movement, and of course she does not want that movement. I'm going to mark her corrugators. Medial head, lateral head. Medial head, lateral head. So we have 5 injections for this glabellar complex. Moving on down to her orbicularis oculi, or her crow's feet. Smile real big for me. That's what we see here, kind of these horizontal creases as she smiles. And relax and smile. Staying about 1 centimeter from that orbital rim. Relax. I'm going to mark 3 sites to kind of get broad treatment for these creases. And smile and relax. Perfect. I want to be sure to stay within that muscle. We don't want to stray outside of it, or we run the risk of hitting muscles that we don't intend to. All right, so Elizabeth is treating this lovely patient with obviously perfect technique. She is entering that frontalis muscle at just a bit of an angle, and she's sliding right into the muscle. If she feels any resistance, you'll see she kind of adds a little bit of pressure to continue forward. She will back up if she needs to. Of course, some will bleed. That's just kind of the nature of this business. No big problem. Also, if she meets resistance, she might be a little bit too deep, so she will back up her needle just slightly. You can see she's kind of holding that skin a little bit taut and working her way from one side to another. We have done thorough education with this patient, but I will just kind of reiterate that. So for 4 hours following this procedure, we're going to have her not lay down, touch her face at all, or raise her body temperature. Elizabeth is angling the patient so that it's a good angle for her. You can always have your patient move slightly, and that needle's going in well. We're using Comfort Tox needles. They are 31 gauge, 8 millimeter long, and they are multi-beveled, so they go in really nicely. Of course, avoiding any visual vessels we can see. Perfect. We are then going to move on to that glabellar complex. We treated her frontalis with how many units, Elizabeth?
5.
5 units, and here we'll use 20. Going straight in 90 degrees, pretty much to the hub. And then when we get to these corrugators, she's going to use the right technique, kind of supporting that orbital rim so that we don't have any drainage down into the eye. Good. Perfect. Moving our way over. You doing okay?
Mm-hmm.
All right, great. This patient did warn us that she does bruise sometimes, but it looks good. She might have a little tiny dot here or there, but I don't think we'll have any big bruising. Good, always that support, you see? And we're not going in too deep with these needles because that frontalis muscle can run behind the corrugators, and we don't want to inject the frontalis with this injection. Perfect. Great job. Just gonna clean this up a little bit and then we will move right on. Okay, we're gonna move on to crow's feet. So, very superficial injection. I'm gonna have you turn towards me. And we're gonna kind of hold the skin really taut. If we can see any vessels, we are going to, of course, avoid those. Okay, so she's holding that skin taut. Perfect. Gonna give a total of 8 units in this area. Perfect. Patient is a phenomenal patient, not even moving a little bit, so we love that. Perfect. No bruising on that side, we love it.
I'm straight towards me this side. Thank you.
Perfect. So with these, the depth is obviously very superficial, just to slide into that orbicularis oculi muscle. We see these horizontal lines because of the muscle fibers. So the muscle fibers are running perpendicular at this point of this sphincter muscle, which is why we get those crow's feet kind of coming out laterally from the eye. And no bruise on that side, we love it.